For hundreds of thousands of South Africans, basic healthcare is difficult to access, and even something as simple as getting your eyes tested can be close to impossible. Rural communities have it particularly hard, with the lack of infrastructure and long distances making access even more challenging. But a new solar-powered clinic is helping to alleviate some of those issues.
Last year, we showcased an internet school project powered solely by solar energy. Today, that same technology is being put to power, and through technology, healthcare is now more accessible to those living in remote areas. Humans have harnessed solar energy since ancient times, using ever-evolving technologies. Solar energy technologies include solar heating, solar thermal electricity, solar architecture, and artificial photosynthesis. In other words, a handful of resources that can make considerable contributions to solving some of the most urgent energy problems the world now faces.
The kind of technology that we use here is what we call polycrystalline panels. So basically we generate all the power. It comes through the inverter, which is a 3 kilowatt inverter that will then change the power into the batteries that will then power the equipment that we've got inside.
Designed as mobile centers, these solar-powered health centers are built for use in remote rural areas and intended to eliminate the economic and geographic barriers that prevent people across Africa from obtaining quality medical treatment.
The reality is that, in sub-Saharan Africa as a whole, over 60% of our people live in rural areas. And so unless you really come up with solutions that you can actually, bring into those communities, it becomes very difficult. So a lot of our people are not able to do any preventative, health and all of that, just because it's either very cumbersome, it's very costly, they don't have time or the money to actually be able to go to the services. And so we, through this kind of initiatives, we're actually able to bring these services to where the people live.
With the knowledge that many people in rural areas do not have the time and money to travel long distances to reach clinics for proactive medical care, the solar-powered health centers are designed to reach as many people as possible and as regularly as possible, mounted on a truck and manned by qualified medical professionals.
Things that happen to people in general affect me, and I think should affect everybody. And when I started talking to these guys, we said, what do? We have a problem. Sitting in our offices in the big cities is not helping us. Sitting at the big hospitals is not helping us. Our message, our education, our preventative methods are not going out there to reach the ordinary people.
The centers will move from one area to the next, providing a range of eye, ear, blood, and dental medical services to the public. The centers will also focus on educating communities about health issues and encouraging people to take tests as preventative measures. The benefits of a solar-powered health center not only furthers development of solar technology in sub-Saharan Africa, but also provides proactive medical care. A goal has been set to have health centers such as these reach 1 million people by 2015, a noble effort that will surely make a difference in many lives.